Heart disease, leading cause of death in America. According to the CDC, 610,000 folks die each year from heart disease. I talked with Dr. Jennifer Caudle about that very issue following the death of legendary journalist George Curry, who died of a heart attack on Saturday.
The heart is a muscle, and that muscle needs oxygen. And the way that it gets this is through blood flow going through the arteries that surround the heart. Now, a heart attack occurs when these blood vessels that carry the blood and the oxygen get blocked. They get clogged by plaque, cholesterol, blood clots, things like that, and the oxygen stops. That's what happens and what can lead to a heart attack is a lack of oxygen to the heart muscle. Now, heart failure, on the other hand, is a little bit different. Oftentimes, heart attacks and things like that can lead to heart failure, but heart failure is really the idea that the heart just stops working the way it should. Remember, that heart is a muscle that has to pump. It's got to squeeze and squeeze and squeeze blood around the body. And sometimes it gets tired, sometimes it gets sick, sometimes it gets damaged and diseased, and it doesn't pump as well. And that's what heart failure is.
Okay, so let's take in the case of George. Last year he had what was described, he wrote a column on this, he described it as a mini heart attack.
Okay.
What is that? So how do doctors determine what's a mini heart attack and an actual heart attack?
Sure. Well, sometimes, honestly, every case and every patient and every situation is very different. But remember, when we're talking about a heart attack, we're talking about a lack of oxygen to the heart. And usually that's because of clogged arteries. Now, sometimes heart attacks can be massive. You probably heard that term, massive heart attack, right? And then sometimes they can be smaller, meaning the heart is less damaged than if it were a massive heart attack. But my opinion with regards to those terms, mini versus massive, probably has more to do with how much of that heart was damaged by not getting enough oxygen in the heart attack. That would be my guess. Either way, it's still a big deal. Whether it's mini, whether it's massive, whether it's, in between, a heart attack is a very serious thing.
What role does diet, exercise play when it comes to reducing our risk of having a heart attack or even heart disease?
Right. So I think that's pretty much the key, right? The key is what can we do to prevent ourselves from getting heart attacks? I thought this statistic was very interesting. One person every 43 seconds has a heart attack here in the United States, which is a big deal. That's a lot of people and very frequently. So the risk factors or the things that would put someone at increased risk for getting a heart attack are your gender. Men have a higher risk than women, and you can't help what gender you are, but that is a fact. Older age, which we can't affect either, and also family history. So for example, if you have a lot of people in your family with heart disease, heart problems, heart attacks, chances are you're more likely to have some of those issues too. But Roland, as you mentioned, there are risk factors that we can do something about, and that is high cholesterol, high blood pressure, diabetes, being inactive, not getting off the couch, being obese, smoking. Those lifestyle factors, we can do something about that. And that's why it's so important that, look, if you haven't gotten serious about your health, if you've been meaning to lose 20 pounds, or you got to get your cholesterol under control or your diabetes, this is really a wake-up call, because getting these things in control can really reduce that risk of having a heart attack, which is one of our ultimate goals.
What about stress?
Yeah, we actually do know that stress can play a role in risk for heart attack and other heart diseases. Stress is a big deal, and I'm kind of glad that you mentioned that, because it's not the non-modifiable risk factors that we talked about, right? It's not the gender thing, it's not smoking and tobacco and cholesterol, but stress is very real. Having a stressful job, a stressful life situation, stress can make a difference. So that's got to be put into our regimen of, we'll think about our overall health and ways to improve our health in general. Yeah, we need to throw stress management in there as well, because yes, it can make a difference when we talk about heart disease.
So when it comes to heart attacks, what symptoms do we actually look for?
Right. That's a great question. So I'm a family doctor, and this is something I'm always asking my patients about. I would say the number one symptom that people often think about, and it's very true, is chest pain. Now, they have to remember, though, that chest pain doesn't have to be sharp and stabbing and crushing chest pain. Sometimes that chest pain is actually more of a chest pressure. I've had patients say to me, doc, I just feel like something is sitting on my chest, or it just feels like something is squeezing inside my chest. That to me is just as much of a problem as sharp stabbing chest pains. So chest pains being one, but that doesn't have to be it. Some people just get short of breath or they get nauseous, and that can be an indicator of heart problems. We know that women often experience what we call atypical symptoms, which may mean that they don't get that sort of chest pressure or squeezing. They may just get pain in their jaw, on the side of their neck, maybe pain down the left side of their arm, or other body pains. So remember, I think the biggest thing here is not to be overwhelmed and say, gosh, how will I know? I think the most important thing here is to know that, look, if something doesn't feel right, if you're experiencing sensations that's not quite right, that doesn't feel good, you gotta seek medical attention, because the signs of a heart attack can be more than just that crushing chest pain.
When I talked to George Curry's sister, when his fiance told him when he called that he had chest pains, he told her, she said, do you want me to call the ambulance? He said, no, take me to the hospital. And Sue said, well, like a man, he said, no, drive me to the hospital. If this happens to anyone at home, should they call an ambulance first versus being driven to the hospital? Obviously, you don't know the distance there. Or do you want them to call the ambulance so they're literally working on that person as they're being transported to the hospital?
That's it right there, Roland. You just said it, and you explained why. If you feel these symptoms, you call 911 and you call an ambulance. And the reason why is because they can begin treating you on the way. If you are in the car with a family member or a friend, that's wonderful, but they can't treat you while you're being driven there. You need to be in an ambulance.
And the time, and if you're suffering a heart attack, every second is critical.
Yeah, time is heart. Time, we always say time is brain in terms of strokes. Time is heart muscle. You want to get there quickly. You want to get oxygen, medications, EKGs, all the things that you need quickly. And remember, if you're having a heart attack acutely, that may actually determine which hospital you need to go to, because not every hospital performs the same heart procedures. And so if your friend or family member is driving you to a hospital, they may not realize that you may need to actually be at a different one. You call 911, get an ambulance there so you can get to the right place and get treated while you're going en route.